Assalamu alaikum, the communication day. We have Miss Anid, 80 years old, was diagnosed as late-stage pancreatic cancer on palliative care. She was admitted 5 days ago with deterioration of her condition. Your role is to sit with her daughter, Miss Rana, and discuss with her the situation and end-of-life care. We'll start in seconds. Okay, ready, Dr. Shema?
Yes.
Okay.
Yes, Dr. Reddy.
Yeah, hello there. I'm Dr. Mukhtar, the doctor in the unit today. You must be Miss Rania?
Rana, Dr. Miss Rana.
Rana?
Yes.
You are the daughter and next of kin of Miss Anit.
Anita, yes.
She's 80 years old.
Yes, Doctor, she is.
Yeah, we are here to discuss about her health issue. Is that okay for you?
Yes, Doctor, please.
Just to confirm, you are the next of kin for her.
Yes, I am.
Okay. Do you need anyone to be sitting with you today in this meeting?
No, Doctor, I don't want any.
Okay. May I ask you what do you know so far about your mom condition?
I know that my mom is diagnosed as pancreatic cancer, and recently she deteriorated, Doctor, and I came here to manage her condition, as she's condition greatly deteriorate. I don't know why, Doctor.
Okay, I'm so sorry to hear about that, Mrs. Rana. Be sure that we are here to support you and your mother as well. Can I ask you what's your expectation about this meeting?
I expect that you will give my mom some medicine and she will return back to her previous condition.
Okay, I appreciate your worry and your care, Mrs. Rana. You want me to explain about her condition, or you're already aware about
Yes,
her?
Doctor, please.
So, what you told me, you know already about her pancreatic cancer.
Yes,
By by reviewing her file and her image, we have some concerning news.
what's that, Doctor? What you mean?
Yeah, the condition is not as we hope. You are following
What do you
me?
mean by what? Yes,
Yes.
Doctor, what do you mean by what?
Yeah, I mean her cancer being more advanced and she's not anymore responding to the what was she was on, which is called palliative therapy. Are you following me?
Yes, Doctor.
Yeah.
Yes, I
Uh,
know that.
yeah, for that, the team following your mother condition have sit together and they are agreed to do and to change the plan of management for her. Are you following me?
How, how, Doctor, they will change the management?
Yes.
They said to me because there is no cure for this disease, and so we'll hear about her symptoms. If there
Yes.
is any new treatment for her condition, Doctor?
Uh, Unfortunately, Mrs. Rana, the news is not good. I'm here to tell you that they are talking about what's called end of life care. Have you ever read or hear about that?
No, Doctor, what do you mean by that?
Yes, I mean that we will be sure that Mrs. Annette she will have the last days or last hours of her life comfortably as much as we can. So we will withdraw some of our management plan previously, like some medication, maybe also the feeding, maybe some support for her, like oxygen or other support she's received before. Are you following me?
What do you mean? What do you mean, doctor? You will leave her die?
I appreciate your concern, Mrs. Rana, and I'm afraid to say, uh, unfortunately, as you know, the cancer shortened the life of any patient. We did our best for her by the palliative management, but since she's not responding to that and the cancer is being advanced, now the plan being changed to end of life care, meaning that yeah, we will be sure that your mother will be comfortable in her last days in life and let her die in peace. I'm so sorry to say that.
Doctor, you said to me you will not. Doctor, you said to me you will not give her oxygen. You will not give her any painkiller. What is this, doctor? You will leave her die?
Actually, we will be sure that Mrs. Annette will be free of pain only. And if she needs some fluid through her blood channel, this is the maximum support we can give to her. If she needs some oxygen, we'll not give her high oxygen, just minimal oxygen she will receive. Did you get that?
What is this, doctor? What is this? I will take her to my home, doctor. You will not do anything for her.
Yes, this decision was made by the medical team in the best interest for her condition, just to be sure that she's not suffering in her last days or hours in her life, just to be sure that she's pain-free and to be around you and you can also sit with her in these moments. In addition, you can call any family member to be accompanying with you to support you emotionally and your other family member in your family. Is that okay for you?
You will give her feeding, doctor. You will feed her.
I appreciate your concern, Mrs. Rana. No, actually, we will withdraw the feeding. We will keep her only on some fluid through her blood channels, along with the painkiller.
Why? Why you will not give her feeding, doctor? Why you will not give her feeding?
Yeah,
She
I
may
appreciate
die
your concern.
from hunger.
We are not sure that she can get benefit from this feeding through the mouth, or she might also be harmed by this feeding. So the best way is to let her die in peace, to put her in some fluid through her blood channel. Is that okay for you?
Doctor, if she won't if she become alert, if she become alert for many minutes, for some few minutes, for few minutes, if she wants to feed to eat, you will not give her anything to eat.
I appreciate your worry and your concern, Mrs. Arana, but um, let me tell you that she can't be even swallows, and if she swallow, maybe she will get choking, and it will harm her more than we expect. That's why we will keep her on some blood channel fluids. Is that okay?
Okay,
Okay, can I ask you some question?
okay,
Who's dependent on
yes.
her?
No one dependent on her.
Okay, do you need anyone to be invited and he can sit with her in the last moments in her life, just to be supporting her and you as well?
Yeah, I want to be with her all the rest of the time.
Okay, did she ask or write some document or wish she want to be done before she die?
No, doctor.
Okay, do you need any other help or support?
No, doctor, thank you.
Any concern, Mrs. Rana?
No, Thank you.
Okay, we have our bereavement team. They can sit with you along with your family to support you emotionally and socially in these moments. Is that okay for you?
What is the name of this team, doctor?
Yeah, they will be sitting with you, supporting you for the emotional moments. As you know, it's very difficult for you to see your mother in this situation. So they will just support you. Is that okay?
Okay. Okay.
Any other concern? I will
No.
hand you some leaflet brochures and website about end of life care. You can read it carefully and our contact number with you. You can contact us anytime.
Okay. Thank you.
Okay, thank you. Time is up. Mm,
انا حاسه يا دكتور ان حضرتك مفيش امباسي ولا سيمباسي خالص بصراحه. يعني
لا بالعكس
حضرتك بتقولي
really?
بروفيشنال.
الموضوع حضرتك بتقولي الموضوع مفيش اي امباسي ولا سيمباسي ولا حتى
At
يعني
all? At all? ما شاء الله يعني ما شاء الله. Okay, we can ask
زي
other
كده ان حضرتك
witness.
سالتني.
No, we can ask other because
يعني اوكي مفيش مشكله. طب بس انا هقول شويه كومنت بسيطه. هو في حاجات ما شاء الله عملتها كويس، بس كنت يعني جد جدا وداخل على الموضوع. يعني ايه، حسيت ان الموضوع فعلا، انا حسيت ان مفيش امباسي قوي. لكن الحاجة كمان اللي سألتني عليها do you want anyone to attend، أعتقد إن ما ينفعش حد يأتند دلوقتي، لأن دي أصلا هي عشان نيكي ستوفكين فحضرتك هتتكلم معاها.
yes, but
فهي
the
لو مش
mother
نيكي
is
ستوفكين
dying.
مش هتتكلم معاها.
Yeah.
بس هي لو مش نيكي ستوفكين مش هتتكلم. يعني فاهمني قصدي إيه؟ يعني ما أعتقدش إن إحنا المفروض نسألها في وضع زي ده.
Okay, please,
أنت
Dr. Shema,
عايزها دور مثلا.
try to make English comment because we have Dr. Azhar, non-Arabic speaker. If you can, please.
Okay. 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 I think you in this situation we will not ask if you want anyone to attend with you,
Mhm,
because she is the next of kin, so we will talk with her. Okay.
mhm,
Another thing, you don't ask me about advance directive. Is she eliminate anyone to take a decision in his behalf, in her behalf? You didn't ask me this question. Also, doctor, if you ask me about does your mother have any wishes regarding what? Regarding her money? Regarding what? You should ask me regarding medical management. You understand me?
mhm. Okay.
And
Yeah, I'm
does
listening
your
to you.
mother
Yes.
have express any wishes regarding how to be managed in the future? Okay.
Okay.
Or does she anyone to take decision in behalf regarding medical management? Okay.
Okay.
And I think
We can't hear you well, Dr. Salma.
feeding what is
Yeah, wait.
Speaker.
Sorry? Speaker?
Yeah, Dr. Salma, can you just come closer to the microphone or something? We can't hear you. Your phone is your sound is a little bit far.
okay, doctor. I will raise my voice. Okay. Regarding also the feeding, one monitor said that we will not talk about feeding unless she asked me. If she asked me about feeding, I will answer like that. We will not force her to take food. If she want food, we will give her. If she don't want and she cannot be swallow, we will not give her any food. As her body may not be able to digest the food, may cause some suffering, as you told us, Dr. Basim, as she may increase her suffering and
Mhm.
will not get benefit from this feeding. And the
Yes.
first priority to us is to keep her comfortable as much as we can to let her die in peace. Okay.
Yes. Yes, okay.
Thank you.
Anything else?
No, nothing. If anyone has a comment,
Yeah, we
say.
can hear other comments until you read the scenario. Prepare yourself, and we will start straight
Doctor,
away
I
after
want
your
to ask you some questions about this scenario. This scenario from Ryder,
Yes, from mine.
I
You
think
practice.
is the situation about the hepatitis B and the vaccination changed a little bit. Changed.
Okay, let's do in the scenario. I will try not to be deep in the details of vaccination, because I saw in the last diet there is scenarios about hepatitis C and I think hepatitis C, right? It was hepatitis C and some medication, antiretroviral. So they might bring this scenario, and I will try to do
my
the
colleague برضه
reports.
to my colleague doctor
Sorry?
to my colleague the scenario in the last diet
Yeah.
to my colleague hepatitis C with my colleague.
I think for starting antiretroviral, I'm not sure about the exact and details of the scenario, but yeah, just to be similar in the infectious process of both viruses. So they might be in around the same situation and some question and concerns. That's why I bring this scenario. Okay, any comment from others, please share the comments, because I can't comment on myself. So I need more comments for the scenario, the concerns.
Yes, Dr. Basim, I have only one comment.
Yes, please.
Regarding the advance directive,
Uh-huh.
it can be asked if she has wishes regarding where she want to spend her last days.
Yes.
Like, because end of
Yeah, I
life
agree.
can be taken in
At
home
home.
or at hospital.
Yes. Agree, 100%. Yes.
Yes.
She can be specifically about this, but I think the time was near to finish, so I couldn't go deep. But anyway, put it in the mind. Whenever you have patient dying, you can specify this wish. Does she need to be at home at the last moment? Or if she raise it by herself, I mean the next of kin. So this is the best for her and for her family to be dying in the family surrounding, I mean. This is good about the living wish. For me, as Dr. Shema said, you have to specify for medical condition. But I disagree for this point, because patient already having cancer, and what she will think about medical condition, she will think about her family, for example, more than the medical condition or medical decision. Anyway, at least you have to raise up this issue. Any advance directive but not as a jargon. Any living wish, or did she wish any documented paper or something to be done before she died? You have to raise up this issue, advance directive. But for the lasting power of attorney, yes, I disagree also. No need to mention, because whenever the decision now, it will not change anything. If I know that she will, for example, Rana will be the one lasting power of attorney, what she will help me for? Nothing. We already take the decision. She will not share the decision with us. So what I get benefit if I ask this question and she told me, yes, I am the one next of kin, or sorry, I am the one lasting power of attorney. So what next? That's why we have to ask for the patient wishes only, and try to apply her wish as much as you can. For example, if she said, yeah, my mother was always expressing that she want to die at her home with her family, grieving something related to these issues, so we can apply it. But for the lasting power of attorney, I don't think it will help in this scenario or other scenarios related to end of life care. Maybe for the palliative care, yes, palliative management, yes, you can share the decision with the lasting power of attorney, because he might live longer than the end of life care. There is also concern in the end of life care for how long she can live with us. So you can still here, it's a matter of minutes, maximum hours. And you can provide support to be around and to be in the same sitting or accompanying the mother in the last minutes or hours. Okay, any other comments? Thank you, Dr. Muhammad.
Yeah, Doctor, I agree with you. And it's very good, actually. It's very difficult scenario. The same thing. So the main thing is that to differentiate between palliative care and end of life care.
Yeah,
I think
exactly.
this is the most. This is the discussion about the type of management that can be provided and not can be provided, which is the same. I think as you discussed with. The most important thing, you can give oxygen, which is good, but little. You will give only IV fluids, pain management, but no any other intervention.
Exactly.
If you want to take food, it will be very difficult for her because she will not swallow,
Yes.
she will have aspiration, her condition
Yes.
it is dying process.
Yes, exactly.
And you can, and the bereavement team can be involved as early as possible, no problem. Because خلاص, it is the end of life care is, as you said, minutes or hours or days, like 3 days, 3 or
Yes.
4 days. So we don't know, we cannot know exactly the time of death, but this is dying process. There is nothing to be done anymore.
Yes.
This is the main objective of this scenario, just to differentiate between what you can do and what you cannot do. Like, of course, DNR is given already. Like, I don't know, we can discuss it or we should discuss it. No need to discuss it unless mentioned in the scenario. I'm not sure because
I
by
don't think.
definition,
Yeah.
by default, DNR is already
Applied.
in
Yes.
in the stem of the end of life care, because nothing to be done.
Yes.
It will not help that too. So no need to discuss it specifically, because the whole scenario is just sadness and empathy. And yes, of course, empathy is good and it should be showed. Your words should be professional and to the point, but a little bit when you say something like, of course, you say, unfortunately, you are sorry, this is the whole, and then just give a little bit tone, change the tone of your voice. The variation of your tone will cause, of course, the two things in our speech when we talk to the surrogate, the variation of our tone and the pauses. So we don't have to be rushed. So when we talk about these things, give yourself time, take a breath, and you talk same tone, and then you just like make your tone a little bit in the low pitch. So that will tell you, will give impression that you are also feeling them. So you can just change it and just try to practice it. That will be much better, I think.
Okay, thank you, Dr. Muhammad. I agree for you. But you want me to be more sympathetic, you mean, right? Maybe the face-to-face will be...
Yeah, because different, yeah.
Yeah, difficult to see the expression while talking online from the face-to-face. So I guess it will be much clear with the face-to-face practice. Anyway, yeah, I will try to change the tone itself. Maybe the face-to-face, the expression of the face may be more obvious. Yes, Dr. Aisha. Dr. Aisha? Sorry,
Sarah.
Dr. Sarah, yes. Go ahead.
About inviting someone, I think it is okay to invite someone in the presence of
Yeah.
no confidentiality here. She is dying.
Yes, exactly. I agree for this also. I agree.
And also about the sympathy and the empathy. Yes.
You mean you agree with her?
Yes. You need some sympathy.
Okay.
Okay.
Thank you,
be
Dr.
more
Sarah.
serious.
Maybe
difficult.
because of the online, yes, practice. But I think face-to-face, I guess the facial expression will show the surrogate or the patient that you are so sad for her, of course. I guess so. So maybe, but I will try also to apply it online. Yeah, much better. Again, for the invitation, if someone is dying, yes, they need this social and emotional support. This is my opinion. I will invite. No worry to do that because the patient is already, she lost the capacity. Right? The patient already lost the capacity, and you have the daughter now alone. So you can invite. Why not? Because no more confidentiality, as Dr. Sarah said, and Dr. Muhammad, patient is dying. Okay, this is my opinion, and I hope it's correct. Any other comment? There is chat message scenario about initiation of ribavirin and hepatitis C. Yes, this was the scenario. Yes, I think the next of kin no need. We mentioned this for the last thing about Fatoni. Thank you for your comments. Appreciated. Let's go to the yes, Dr. Zahar.
Can you
Walaikum assalam.
what is the basic difference between palliative care and end of life care?
Yes, good question. So the end of life care means patient is dying faster than the palliative care patient. Palliative care patient might live longer, maybe months, even up to a year, because still he has some maybe chemotherapy in the form of palliative. He can receive medication, he can receive antibiotics, he can receive antidepressant. So he might live longer than the end-of-life care patient. End-of-life care patient means he is dying, gasping, has intracranial hemorrhage massive, or advanced cancer with spread a lot of metastases. And as in this patient, cancer, advanced cancer with, for example, compression to the pancreatic duct or whatever. So it will be decided in the scenario either end of life care or palliative care. Palliative care might be cancer just discovered, and the patient will receive some chemo or radiotherapy as palliative, or he might just receive the antibiotics if he has infection, some antidepressant if he has depression, hydration. All these things will be offered for the palliative management. In the other arm, the end-of-life care, just you can offer IV fluid, oxygen, minimal oxygen, and wait for the patient to die in peace. Of course, in both patients, you will not do CPR. So I mean, it will be DNAR. Do not attempt resuscitation for both patients. But you have to explain it more with the palliative patient. Why? Because palliative patient expected to live longer than the end-of-life care. So he might be admitted in the hospital, not expected to die soon, but if the arrest happen, you have to explain to the relatives that we will not do heart massage for him. End of life care, by default, as Dr. Muhammad said, by default, he will not be resuscitated because he's dying in front of the patient, and he already suffered a lot because of the cancer, suffered because of the coma, because of ICH, whatever, a stroke, previous stroke, whatever the situation. So you got this point now.
Yes. Thank you very much.
Excuse me, Dr. Basim. I just do not agree with that palliative care, including DNR, because patient with palliative care can actually live for years.
Yes, I agree.
So we can even do palliative surgery or palliative procedures.
Agree, yes.
Yes, so DNR not discussed with palliative care.
Yeah, it's not necessary. Yes, if I said it's necessary, no, it might be with or without, according to the scenario. It might be in the scenario or not, but in the end of life care, yes.
Yeah, it can be mentioned, yes, in end of life, because actually it's part of the end of life that we will not resuscitate if the heart stops.
Yes, exactly. Yes. So in the palliative, as you said, doctor, in the palliative, plus or minus DNR, but in the end of life care, definitely he's not for resuscitation. But in the palliative care, he might or she might or might not. this is the difference between also the palliative and end of life. Because palliative, as Dr. Muhammad said, he might live longer. Maybe also he undergo any surgery, chemotherapy, radiotherapy, under the term of, again, palliative. So palliative surgical or palliative chemo or palliative radio, or whatever the decision according to the nature of the cancer. Thank you, Dr. Muhammad, for the...
Okay, can I
Yes, sure.
explain what I understand about palliative? Palliative mean like symptomatic treatment, supportive treatment,
Yes,
psychological and the social help, and
yes,
also we could ask the patient to express his wishes and also to name last power of attorney. We
yes,
can may talk about experimental treatment that he can look for and may try to search about it. I think this is like this يعني in websites or YouTube or كده. أما بالنسبة ل end of life care I think we just take all the treatment, we just take all of the medication,
yes,
right?
yes. Good point you mentioned, withdrawal. End of life care, if already patient was under palliative care and he's, for example, ICH patient or intracranial hemorrhage patient was connected to ventilator, and the decision now for end of life care, you can do what's called withdrawal of medication or withdrawal of treatment or withdrawal of management. So it means that you can remove the ventilator, you can remove the medication he's on, like antibiotics, for example. You can withdraw the active management already decided by the team to be applied for the patient. So this is also point in the end of life care. You can withdraw. Yeah, thank you, Dr. Sarah, for this
Okay.
clarification. Yes, thank you. One more, Dr. Samah asked if palliative or others cancer not resuscitate. Not all patients with cancer is not for resuscitation. Some cancers might live longer and just do some palliative support in the form of chemotherapy or medication, hydration, or whatsoever. Capacity of patient, one of differential point. I cannot understand this. Only maintain patient dignity. Yeah, this point also very nice to be mentioned while discussing with the daughter. Yeah, we are trying to preserve or to keep her dignity as no disfigurement of the body by doing heart massage. Agree for this point. Yeah, Dr. Shaima, remind me about my scenario in the exam. It was end of life care with ICH hemorrhage. And the plan was to withdraw the machine and antibiotics because she has aspiration or he has aspiration. I got 14 out of 16 in this scenario. I guess because I was doubting about the name of the patient because I look at the paper two times while mentioning the patient name to the daughter. I guess so because it was in the clinical communication. This marks, I mean. But apart from this, what I did with Dr. Shaima today, I did all steps. And I guess it was the mark deducted for the clinical communication for the patient name when I read it from the paper. That's why I'm advising all of you, try to memorize the name of the patient before entering the station. They might deduct your mark for this, according of course, according to the examiner. Other examiner, no one care about that. But sometimes some toxic examiner, they might cut your marks because of this, because of reading the name from the paper. I don't know how they want us under stress to recall the patient name without looking at the paper. Anyway, just take the advice and follow it. Whenever you go to the station, while going inside, try to repeat the name of the patient inside yourself and in your mind, just in order not to look at the paper while talking to the surrogate. because whenever you look at the paper, he will cut your mark. Okay.
دكتور
Let's
باسم حضرتك قلت في تيم حضرتك اللي هو اسمه
bereavement team.
bereavement
Bereavement
team.
team. Yes. BEREAVEMENT. I will mention in the group, no problem, in the WhatsApp group. And also I add in the scenario while, and I mean in the exam, I add spiritual team. This is also another team you can invite. Spiritual team, the team assigned for the religious issue. For example, in our yes.
Included in
Maybe
in
yes,
the
you
bereavement team.
can mention both, because yeah, some religious groups in family or in public need to call someone sheikh or whatever according to the religion. So you can invite this one. Okay.
Okay. Let's start.
Yeah, let's start. I will reset the timer. Yes. Okay, here you go.
Hello, I am Dr. Robert, the doctor in the medical ward today. Are you Mr. Ali Khan Fah, 26 years old?
Yes. Yes, doctor, I am.
Today we are here, Dr. Ali, to discuss issue related to your health. Is it okay with you?
Yes, doctor.
Dr. Ali, can you please tell me how much you know about your health status?
Doctor, I'm quite fine. Nothing happened to me. I surprised when they told me when I do some checkup for myself, the blood test showed that I have hepatitis B infection, and it was shocking for me.
I'm sorry for that, Mr. Dr. Ali. I'm really sorry for that. And I know I want from you to tell me what's your expectation from this meeting, Mr. Dr. Ali.
I am concerned, doctor, about my career, my job. I'm so worried, doctor. They will remove me from the practice in the operating room.
I'm really sorry for what's happening, Mr. Ali, and I really appreciate your feeling. I know how this news is very terrible, and I am very sorry for this. Let me to explain to you more, as you are a doctor and you know that this is hepatitis B affecting your liver, and it can be catched in many ways, like exposure to blood and also through sharing needles. It can also catching this infection through sexual activity with someone who has this infection. Actually, Dr. Ali, as you said to me, you are a surgeon and you are a bright doctor and care-minded. That you are a surgery and have surgical rotation. I am sorry for what happened to you in this situation. Actually, we should involve the infectious team doctor and infectious team, and also involve the occupational health doctor to know if you allow to manage and to continue as a surgeon under certain precautions, or you may be not allowed to be in direct contact with the blood of patients. I'm sorry for this, Mr. Ali, Dr. Ali.
Yeah, doctor. This is my main concern, doctor. So you mean I will not go back to my operating room? I will not I have contact with these patients?
Actually, Dr. Ali, we need to involve the occupational health doctor and the infectious team in the hospital, and to assess your investigation again. And you don't take any immunization before, yes? vaccination
I
before?
can't remember, doctor. Yes, I guess so.
Yes, okay. We need to assess you again and to know according to the protocol of the hospital if you can manage certain operations under certain precautions, or you will not be allowed at all to work as a surgeon.
Mm-hmm.
So
Okay, doctor.
what we need to do now is to start the treatment and to allow to involve the occupational health doctor and the infectious disease team to show how they can help us in this regard. Are you following me, Mr.
Okay,
Dr.
doctor.
Ali?
Yeah, doctor, I'm
Okay,
following you. I can understand what you said to me.
okay, Dr. Ali. I really appreciate your feeling, and I am really sorry for what happened for this bad information, bad news that you have today. And I wanted to ask you some questions. Are you married, Mr. Ali?
Yeah, doctor, I have my partner.
Okay, do you have any kids?
No, doctor, but we are planning for.
Okay, actually, Mr. Ali, I advise you to tell your wife about about this result, and I advise you also to convince her to do the investigations, as if she has catch this infection, she can start the treatment early, and she can take prophylaxis if she becomes pregnant to avoid the transmission of this infection to your baby. Are you following me, Mr. Ali? Dr. Ali?
Yeah, doctor, I understand this precaution, and yeah, I will try to follow this precaution in the future.
Actually, Dr. Ali, I just remind you that your sharp object should be kept away from any other person, and should be personal use only.
Okay, doctor.
I'm sorry for this, Dr. Ali, but I read I want to remember you only that you have that you don't allow to donate your blood for organ donation.
Okay, doctor.
Okay, Dr. Ali. Actually, Dr. Ali, I think your insurance should be informed about this result, and you may find Dr. some difficult to renew your insurance. What's the recent one, and the recent one is preserved. Are you following me?
Yeah, doctor, I can understand that also.
Okay, Dr. Ali. Dr. Ali, what we need to do now is to start, as I told you, to start a treatment which will be in the form of antiretroviral. You are a doctor and understand me. This is medication that decrease the reproduction of this virus, and it decrease its effect on the liver to decrease the effect of this infection on the liver, and to prevent the cirrhosis after that. But we may need to take this medication lifelong. As you know, Mr. Dr. Ali, this infection is not curable. We try to decrease its progression, but until now, no cure from this infection.
Okay, doctor, 2 minutes left.
Dr. Ali, are you following me?
Yeah, doctor.
Okay. Dr. Ali, can you please tell me how much you know about it from this meeting?
Yeah, doctor, I got this infection maybe from needle stick, or maybe from sexual relationships, and you inform me that I will be banned from doing some surgery in the coming days, and you will refer me to the occupational worker. to help me for detecting the viral load in the blood and to know more about this infection. Depend on based on this result, you will refer me either to do work again in the surgery or not, and you will give me some medication for this infection.
Okay, okay, Dr. Ali, I will give you also some leaflets and some brochures on the website about this infection, hepatitis B virus, and if you, I will give you also my phone contact number, my hospital contact number. If you have any inquiry, don't hesitate to call me at any time. Okay, Dr. Ali?
Yeah, doctor, I
Okay,
have concern, doctor. You didn't ask me about my concern. Please,
yes, what's
doctor.
your problem?
It's a favor, doctor. Please don't inform my consultant about my result.
Actually, Dr. Ali, I appreciate your feeling and your but we should involve the occupational health doctor, and he is the one who will be he will inform your consultant and your employee about this disease and your precautions to act to work as a surgeon.
Okay,
Do
time
you
is up.
understand me?
Yeah, I understood,
Okay.
doctor. Thank you. Time is up, Dr. Shema. Thank you. Well done. Now let's comment. Yeah, you did great, really. You asked the most of the question and the concern, and it was mentioned in the book. I think you practiced this scenario before, right? So
No,
it's really good.
not
No,
not
good to know. Because this was mentioned in the scenario in the exam, sorry, in the book, rather. I will share the uh, the scenario in the WhatsApp group. The three concerns were about the practice again, doing surgery, and the confidentiality. You have to assure me about the confidentiality from the beginning. Be sure this meeting is confidential. No one will know about the details of this meeting. Try to do as a habit in two scenarios. Infection scenario like HIV and hepatitis and some certain infections which are risky and some confidential, I mean. You have to assure the confidentiality for this infection and the news about the result. The other scenario will be the suicidal attempt because it's sensitive scenario. No one should know about the attempts and so on. Both scenario you have to assure the confidentiality from the beginning. Let's go back to the name. Try as I warn you. You are kept repeating doctor and Mr. Doctor and Mr. Yes, he is doctor, so he's your colleague. Suppose in this scenario he's your friend in the hospital, and so you can call him doctor as you did. But sometimes you forget and you are saying Mr. Ali. Anyway, it's not major
أو
issue.
أنت ما كنتش عارفة
Yeah,
at the
yeah, it's
beginning I
doctor.
was confused.
Yeah,
Yes.
no problem. But he's in the scenario mentioned that he is your friend in the hospital. Okay.
Okay.
Let's go back to the occupational. Yes, the good decision is to be referred to the occupational, and they will decide what to do further. Is it a referral to lab to repeat the test, to do the hepatitis E envelope, I mean, for infectious, if he is infectious or not, and to detect the DNA titer or load of the virus in the blood. According to the numbers, I will not go details or deeply in the details of the numbers. They mentioned below 1,000, more than 100,000. I don't think this is
أعتقد
important
دكتور
anyway.
I think this guideline changed دكتور. I
That's
think
why,
this guideline changed.
yeah, that's why I'm not going to this deep detail. Anyway, just to refer him to the occupational is best way and diplomatic answer. They will decide what to do and what to test and what to decide. Either you can undergo the surgery before, you can have contact with the patient or no. But according to the level or according to the infectious level of your viral or virus, either you can do major surgery or you can have some minor surgery in order not to forget your practice. This is some of the details, but it's not important. What you did is perfect for me. You just touch the point of referring the patient to the occupational. The occupational will do some tests to check his viral load and to do the optimum management for you. Then the point of don't tell my consultant, yes, this is his right, but you should encourage him to know. Why? Because you're gonna do work with him. He should know. And if you are infected or you are contagious to others, you might not join the surgery. So he should know also why you didn't join or why you didn't do the
But
practice.
and I think this is occupationalist doctor also. He is the one supposed to do that to inform the consultant and to put the precautions for
Yeah,
his job.
what you did, Dr. Shema, is great. I didn't say just I'm reading or I'm repeating what's written, recalling what's written in the book. But what you did for me is perfect, optimum, and diplomatic in everything for the confidentiality, for the decision of doing the surgery or not, for the the other point also for the private tools or instrument, you have to avoid it with your partner. You have to encourage your partner to do the work, to know the result and to avoid to be sharing the private things with you. And first question you have to ask about when you said, are you or did you receive your immunization? It's important to know and important also to ask this question because he had the needle stick on background of non-immunization. I think if he's immunized, he will not have this infection.
But doctor, in scenario, they mentioned me, he is not immunized. Should I ask him again?
Yes, you can ask this question. What about your status or your immunization status? Are you sure? Did you take your immunization before practicing the surgery? Okay, this is what's written in the book. The writer. I try to make as the book steps, and I will share also the scenario in the
I have
WhatsApp
question,
group.
doctor.
Yes, sure.
I have question. I said to him, there is no cure from this disease. Is it okay? Or no?
I guess
I think there is no
hepatitis
cure from
C,
this disease.
the one is curable, not B. Sorry?
Hepatitis B no cure, yes?
Yes, hepatitis C is the one cured, but hepatitis B controlled or controllable one.
Controlled one. Yes.
Yes. Okay, any other question, Dr. Shema?
Shukran, thank you, doctor. Thank you.
Yes, well done. But please, Dr. Shema, whenever you hear 2 minutes left, you have to ask the concern. You were about to miss the concern. Okay, in the exam, no one will remind you about the concern.
Yes. Because doctor, first thing you said to me, the thing what I concerned about, doctor, my job. So I talk about this and I forget to ask about concern again. Yes.
Forget it. He might have another concern, and there is marks for the concern. So don't assume that he asked me concern here, so I answer his concern. No, he might give you another concern in the 2 minutes left.
All right. Yes.
Yes. Okay. Any other question?
Yes.
Okay. Any other comment from others? Okay. Walaikum assalam. Yes.
Can you tell me there is any difference between palliative care and end of life care?
Yes, we mentioned earlier the difference as.
Sorry, I didn't.
No, it's okay. We will repeat it. No problem. You have any question for this scenario? A hepatitis B scenario or only for the previous scenario?
No, only.
Okay. I will repeat it after finish the comment of this scenario. Then I will repeat the palliative and the end of life care. Okay, just to be in in order for the practice. Anyone? Thank you, doctor. I will mention the difference later. Any other comment for this scenario from others? Any comment on Dr. Shaima performance? Anyone want to advise here? Any question? Yes, a good
If
advice.
the patient doctor can tell him about the risk factor, transmission, he already knows about this. Can tell him again, and
Immunization, you mean?
also avoid the jargon with him like other.
No, you
The
told
patient,
he's doctor. No, he's a doctor, so you
yes,
can
his
use
doctor.
medical term. It's okay.
Yes, also need to tell him about avoid do safe sex and avoid
Yes,
contact with
she mentioned
patient.
yes, and blood
He
donation.
know
All yes, all this mentioned. Yes, you have to. Yes, you have to.
if he know already, tell him about that again.
Yes, of course.
Uh,
This is safety
okay,
netting.
okay,
Even he
okay.
knows. Yeah, this is it's called safety netting. You have to do it in any scenario with infection. It's a matter of
Okay,
show. We agree for that. It's a matter of show. You are showing the examiner that you are giving advices, you are taking care of the patient, you are following up the patient. It's a matter of show. Okay, thank you. Other question. Yes, shall we involve hematologists? Yes, good point. It was mentioned also in the steps in the book. So you can say we will refer you also to the hepatologist if he is doctor, but if he is patient, you can say we will refer you to the gut or to liver doctor. He will be also managing or sharing the plan with you. Yes, you have to be good and professional actress. What happened to his insurance? Dr. Shema to say or wants to say that whenever he's got infected, in the next insurance will be affected also because he might need some medication, so he will need also some investigation, some imaging, and the insurance will ask him or will get more payment for that. So they will raise his level of insurance. This is in any institution. Whenever you have, for example, even for the car, for example, if you have accident and you inform already the insurance about the accident, they will raise up your value of insurance in the next year. Why? Because you had accident before, so they are afraid of having another and another. This is the same issue. Whenever you have disease or patient have disease, they're afraid of the cost of the next management investigation, and they will raise up the value of your insurance. This is the same point or the same concept. Okay. What happened? Yes, finish this question. For more workup, decision to start antiviral. Exactly, yes. The decision for antiviral, as Dr. Shaima said, occupational and hepatologist and infectious. They will decide when to start the medication and what will be the medication. Don't go through these things. Just be general in talk. Don't specify medication. Don't say the side effect or unless it's written in the task. You have to, for example, the other scenario, hepatitis C virus, there is different scenario and different task. We will try to practice this scenario later on in another day about interferon or whatever the medication to be started, because you might have this scenario in the future. Sorry, another one question. Can we raise to be tested for HIV? And actually, it wasn't mentioned in the book, but yes, it's a valid point. You can ask or you can involve this test because needle stick not carrying only the risk of transmission of hepatitis B, it carry risk also for HIV and hepatitis C. But this scenario was confined to hepatitis B. That's why it was the talk about hepatitis B. But in any needle stick, you have to screen for all viruses, HIV, hepatitis C, hepatitis B. And whenever the scenario about needle stick for HIV, you have to mention the other virus. The same point here. Whenever the scenario about hepatitis B, you have to mention HCV or hepatitis C and HIV. Yes, I agree for this point. It's the scenario is not. I mean, it's not book to follow. You can do some things which is related, and it will be accepted. Okay, so it's not steps, but it's scheme. You can follow the scheme, but don't stick to the book. You can do something from your side. You feel this is beneficial, you can do it. Try to talk about the follow-up and the care as much as you can in any scenario, because it's a reassuring point and the patient is already disappointed from this infection. Okay, if no more question, we can go to the difference between palliative and end-of-life care. I will repeat it again. So starting by the palliative will be for the patient who's having newly diagnosed cancer or stroke or something he might live with, but he might need support. So let's assume patient with cancer just discovered now. For example, hepatocellular carcinoma. So he might live longer, but he will receive some medication. He will receive some, maybe they will offer him chemo, radio, under the term of palliative chemo or palliative radio. So this patient might live longer, might live for months up to years. But end of life care, let's talk about the duration. Patient already diagnosed and his condition deteriorated, and he had multiple comorbidity, multiple infections, and he's suffering a lot, and the condition not responding. He's connected to ventilator with no response. All these patients will be under the term of end of life care. And what they will do, they will withdraw all medication for him, the antibiotics, they will stop the feeding, they can stop the ventilator, they can remove the tubes, any procedure they can remove. They will let the patient die in peace, giving his dignity without, of course, they will not do the CPR or heart massage for him. In the other arm, the point of heart massage for the palliative therapy patient, he might or he might not receive CPR. This is for the palliative therapy. Patient might live longer, so he might live without heart massage, or you can offer DNR according to the scenario. If written in the scenario, don't resuscitate, you have to raise up this issue or this way. If not written, don't raise it. In the end of life care, by default, patient will not be resuscitated because you are leaving him die. And as mentioned by Dr. Muhammad, it's dying process means that he might die after this meeting, or at the end of this meeting, you might write his death certificate. Why? Because already you stop everything for him. You stop medication, you stop antibiotics, you stop feeding, even you stop the ventilator or high oxygen support. You can put him only on little oxygen. This is for end of life care, and this is the difference between end of life care and palliative therapy. Okay, any question regarding these scenarios, or palliative or end of life? Any question for other scenarios? Any point to be raised? Any comment to be shared? Please feel free to comment. I like when someone comment or giving advice. Whenever you give advice verbally, it's much better than writing. Why? Because you get more confidence to talk and to advise and to share. And whenever you share, the information will be more memorizable for you. Any question?
Hello, Dr. Basim.
Yes, Dr. Afak.
Hi. I'm just asking about breaking confidentiality in this case. because like if the doctor insists not to inform the occupational health or the consultants, in this case, should we break the confidentiality and inform the consultant or not?
Yes, you have to get his permission for that.
If he refused.
So yeah, so you can assume that you are getting his getting his approval for breaking the confidentiality while talking to him with him. Because once you mention that we will inform the occupational, and he said yes, okay, what do you think about that? Yes, I okay. So this is approval from him.
Yeah, but in some case he refused. He totally refused. So just I need to know the
Yes,
approval.
if he refused, this is his confidentiality, and you have to follow it. But you
But
have
there is
to
harm to
convince.
patients. There is harm to the patients if he
Yes, of
if he
course. Yeah.
being said with a procedure.
Of
So like
course.
according to the GMC, if there is harms to other, in this case we can break confidentiality.
Yeah, this is another point. Whenever it will harm the patient, no, sorry, I am sorry, I can break the confidentiality. I have to strict you from contacting the patient or doing the surgery to the patient. So
Okay.
we are talking about the patient safety and also for the doctor safety, right? In this
Right,
time,
yeah.
yeah, the confidentiality must be breached, but you have to convince him earlier.
Right, yeah. Thank you. Yeah, I
Yeah,
think
most
our
welcome.
aim is just to convince him, yani make effort to convince him.
Yes,
But
exactly.
but if he refused, like it will be like end
If he
point.
refuses, you can make another meeting and again try to convince. But if he insists, you have to inform
Yeah,
because
thanks so
it will
much.
harm. The same point of HIV and the partner. I want you to inform your partner about HIV. No, doctor, I don't want. You have to convince him. If he refuses, you can invite his partner to co-meeting with the consultant, with the partner, and with the patient. And if he refused at that time, you can breach the confidentiality. But if you did your effort and he's convinced, it will be much better. It might be the task of the scenario.
Yeah. Got your point. Thank you so much. Thank you.
Yeah, most welcome. Thank you too. Thank you, Dr. Afak, for this question. It's a very important point to be discussed and to be known by all of us. Any question, any point to be shared? Nice session, really. I enjoyed this session because of a lot of comments and advices. And I want to encourage others to share and to comment usually in every session. Okay, I can end this session if no more question.
When
And no more
Doctor
comments.
asked you about the difference between palliative and end of life care, not answer her.
Oh, really?
Yeah.
No, I answer.
I said for how it till finish this discussion about this session. I don't know, maybe she
No,
used
no.
okay.
Are you absent? I discussed it a couple of minutes ago.
Well, okay. Because just now this discussion finished about the second
No.
session.
I in
Second
between
case, I mean.
in between I discuss it again. والله.
He's answered. فاطمة مركزة. خلاص, thank you.
No problem. It will be in the record.
دول.
No,
لا
doctor.
خلاص.
No worry. The record will be shared after maybe 2 hours. It will be in more details about the scenario itself. I mean the end of life care scenario, and also in the discussion after the scenario we had mentioned the difference. And again at the end of the session you can listen to the difference again. But I swear I did it, wallah. Maybe you didn't hear it. Okay. Yeah, I think maybe you slept for a while. Yeah, thanks, Dr. Samah. He answered. Yeah. Okay, no problem. You can hear it again in the recording. Okay, thank you, everyone. We'll see you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam. Thank you.
شكرا.